My mission was to stop the spread of MRSA in the hospital and the community, identify its reasons, and develop devices and methods to help reduce its spread. The device manufacturers protecting the return on investment said it's not in their interest to deskill doctors, so I was disappointed. When I began to notice the mistakes made by nurses and doctors who caused unnecessary deaths, I became uncomfortable. It was hard for me to continue working in the hospital, the Doomsday doctor, or they insulted me. So I stopped working in the hospital, retrained to become a family doctor, and stopped searching for a solution to avert the antibiotic resistance crisis. It's only after ChatGPT identified the website gosurgery.com, which I published in the 1990s, and named the pioneer of patient-centered care to protect humanity, long before tech giants entered the arena, made a symptom steer I developed, and monetized I realized the importance of my contribution, and so sharing information to make people stop blaming doctors and empower themselves. Doctors have surrendered their free will to hoard wealth and forgotten what they forgot. I, who created the first symptom check, stopped updating the site because I felt that giving importance to diagnosis is not in the interest of humanity and inflicts more harm than good. In 2002, I became a father. As soon as I saw the sparkling eyes of my newly born daughter open, the fear about staphylococcus infections of cuts and bruises that often occur in childhood can result in sepsis and death. Knowing that MRSA infections would create an army of bacteria by sharing plasmids was frightening. My mission was to find a solution to help patients with symptoms and signs suggestive of infections so they would not travel to the hospital or consult a doctor and spread disease. It was also essential to help parents identify infections early, isolate the child or adult to protect the family, prevent travel, and protect healthcare workers. I started collecting and compiling a list of common presenting symptoms and signs. I created a color-coded system that people could use to differentiate common from serious illnesses and infections and isolate them at home. In 2003, I created the color-coded symptom checker under Medical Advice You Need and later changed it to Medical Advice You Access. A nurse working in a local surgery called and invited me to work in a pilot nurse-led practice. This was the first experiment to see if nurses could diagnose infections and prescribe antibiotics. I took the offer, hoping to validate my innovation, Maya, a color-coded symptom list to help the receptionist. She must not refer patients with red symptoms, but only green ones. Unfortunately, this was not popular with nurses because they called themselves independent nurse prescribers and believed they had the knowledge and experience to diagnose infections. I became a victim of harassment and humiliation, hoping I would resign, but I did not. As a doctor, I am governed by the Hippocratic Oath and must protect fellow humans. So, the torturous conspiracy continued. Lives of innocent patients whom I was fond of suffered and died. It was heartbreaking. I would have prevented the complication if the patient had consulted me. This made me angry, because the nurses did not appoint a doctor when I was on holiday, and they managed to offer medical services independently. This is not only unethical, but criminal. When I questioned the nurse in charge of the surgery, I asked why I was concerned when the chairman of the Surrey Primary Care Trust was not bothered. I raised a concern and sent numerous emails, culminating in a serious battle. I was suffering because I did not have any friends or family to grieve with. Focused and determined to stop this substandard care, I collected more evidence to prove negligent care. The false claims and instigated complaints from patients that nurses used to discredit me were traumatic, and so I was scared to work as a doctor in the UK. The investigation using documents with numerous factual errors did not help Surrey PCT refer me to the GMC. My name was removed from the performers list, so I cannot earn a living to sustain my family. After 9 months, they reinstated my name on the performers list, lied to GMC, imposed IOP, instigated an investigation, and harassed me. They aimed to prevent me from working as a doctor again. It was traumatic and against the law of the country to victimize whistleblowers and vulnerable adults, but they did not care. Parents of my daughter's classmates were also treating my family and me as lepers because they thought I might have molested a child or sexually abused a patient. They could not believe I had made a protected disclosure in the public's interest. Honestly, Living in the UK as an Indian and a German family with no money, job, family, and friends is worse than living in a prison or hell. I am strong because I know I am protected by the universe and have been honest and determined to protect fellow humans and my ethics. I knew my life would never be the same, but my effort would be recognized, and people would be protected. Knowledge of health is knowledge of life, and so sharing my knowledge, which I acquired working as a doctor for more than 40 years, is the best I can give before I die. The nurses told me I could not work because my name in the performers list miraculously vanished. The process of reinstating my name dragged on, so I was bankrupt. I had to make significant personal sacrifices to survive. I sold my car, could not get locum jobs, and struggled to pay medical indemnity insurance. This experience profoundly affected my passion for medicine, and I found myself on the verge of despair. Despite the challenges, I was determined not to let this situation defeat me. I decided to remove my daughter from her private school, move to Germany, and stay with my in-laws, but I remained resolute in my mission. In 2009, I wrote to the World Medical Association, the World Health Organization, the local medical council, the General Medical Council, the Royal Colleges, the British Association of Doctors of Indian Origin, and the British Medical Association. Dr. David Haslam of the BMA advised me to take legal action, but said he could not intervene. No person or doctor came to help my family or me. We suffered because of financial difficulty. Once the name on the performers list was reinstated, the PCT paid me for the loss of income, so I filed a case against the PCT in 2010. I started seeing flashing images resembling 7i in Germany, which determined me to continue. My father and relatives are Vedic scholars, and they said, "I have been chosen to do all that I can to protect our ancestors." This made me go to my birthplace, Udupi, and spend time in my temple, Kadiyali. I realized our ancestors were not humans, but the very bacteria, viruses, and fungi that created life on Earth. They are not happy because we humans have polluted the Earth with toxic chemicals that make it difficult for them to survive, and so we will wipe out a generation. In 2011, I shared my story and explained how doctors and the Surrey PCT destroyed my family, home, financial health, and passion after raising concerns about nurse prescribers and practitioners. I became a victim and could not return to work as a locum in the UK. We were forced to sell our house in the UK, and I filed a case of torturous conspiracy against the Secretary of State in 2011. I took voluntary retirement, so my wife was fed up and moved to Germany. Here I spent time learning German and writing my first book, Maya Brings Tears of Happiness. I also started thinking about the flashing images that resembled 7i. Initially, I thought I was going mad. The post-traumatic stress disorder was more challenging to cope with, and the thought of the trauma my family and I went through was hard to bear. After interpreting the image as a message, tell me to integrate innovation to help initially identify infected and isolate them, I returned to India and started meditating to regain my strength. I established a company, 70 Med, and published my book, but living on a pension, I could not spend money to market it. Paying the solicitors to force a stop to unethical medical practice in the UK was hard. The solicitors did all they could by dragging my case and using technical arguments to prevent it from going to trial. People did not buy my books or download the Dr. Maya app to conquer their fear of self-diagnosis. The app uses a color-coded symptom combination to differentiate common from serious illness or infections, reduce travel and hospital visits, reduce cost, and prevent the spread of diseases in the community. My effort to help empower people to reduce the culture of dependency on doctors failed. I stopped spending time and money and continued writing articles about bacteria, fungi, behavior, and relationships. I was also searching for an alternative method to prevent the spread of MRSA and other bacteria in our community. In 2018, I returned to London and started working as a locum in NHS 111 to learn about nurse triage. Honestly, it was frightening to see how offering advice to patients in distress had deteriorated to quackery. Nurses, doctors, chemists, and teenagers claiming to be medical advisors were all made to sit in a big hall, take phone calls, and give advice following questions written using algorithms. They claimed to follow evidence-based medicine, Follow guidelines to make sure they are documenting information, calling this safety netting. The advice offered was not empathetic and did not show compassion. Most doctors were from India and had not worked in NHS hospitals like me. They only followed protocols and documented information because the doctors appointed to monitor them were auditing the information reported in the computer to ensure its safety. In 2019, the High Court and Supreme Court judges read my story and supported my claim. They say, by neat technical swipe, the Secretary of State would have eliminated a substantial claim without any tribunal or court having heard any evidence or argument about it. That seems to be a decision any principle of the cause of action does not drive this court. Lord Justice Kitchen and Lady Justice Asplin agreed to Lord Justice Lewison and allowed the appeal. NHS managers and solicitors agreed to liability, so I was forced to settle out of court. They refused to pay for the loss of income, saying I did not have all the payslips and documents to prove the money I earned. This was difficult because I had not saved them, and so I was forced to settle out of court because I was bankrupt and struggling to survive. In the meeting, I was relaxed and listened to the solicitors, knowing the world would be in turmoil if the people in power made me suffer. I heard the news about the spreading infection in China and knew the universe would bring the NHS to its knees and millions of people would suffer.
Healthcare professional-focused medicine is at a crossroads. Patients are losing trust, disparities are widening, and systems are overwhelmed. Dr. Maya GPT offers a new compass, one that protects life, restores dignity, and upholds medical ethics. This is not about replacing doctors. It's about empowering patients, reducing preventable suffering, and creating a universal standard of care that reaches even the most vulnerable. By preventing fear, ensuring early triage, and breaking language barriers, Dr. Maya strengthens the very foundation of medicine, trust and protection. For healthcare professionals, this is an opportunity to partner in building a system where healthcare no longer conquers disease, but protects humanity. I am Dr. Kadiali Srivatsa, a physician and critical care specialist who has spent decades witnessing how fragile and unequal our healthcare systems truly are. From hospital-acquired infections to global pandemics, I have seen preventable suffering destroy lives. That is why I created Dr. Maya GPT, a revolutionary AI healthcare assistant designed to reduce disparity, defend ethics, and protect humanity from epidemics and pandemics. Dr. Maya empowers people everywhere, educated or illiterate, rich or poor, with accessible, multilingual guidance that prevents fear, delays, and exploitation. Leaders may hesitate, but humanity cannot afford to wait. The world needs a new healthcare model, ethical, universal, and preventative. I am now seeking like-minded companies, innovators, and partners to join me in scaling Dr. Maya globally. Together, we can build a system that saves lives, restores trust, and safeguards the future of healthcare. Let's protect humanity before it's too late. Scan the QR code to learn more. Thank you.
I published my third book, Dr. Maya Protecting You, Protecting Us, hoping the leaders in the UK will read it and stop thinking they can invent drugs and vaccinations and manage the crisis. The leaders of nations are brainwashed to believe doctors working in the NHS are living under an illusion based on theoretical idealism, not understanding the practical realities of managing pandemics that affect 8 million people, and not a million as in the 1920s. After COVID-19 started declining, the WHO declared the pandemic over. The false sense of security made people believe this and ignore the silent pandemic spreading throughout hospitals. I was happy to hear from people who read, watched my videos, or listened to my lectures, who started believing my intuitions were accurate. Honestly, I was not bothered because my contribution to help protect humanity was a curse, though my mother said, honesty and integrity will always be rewarded, to encourage and motivate to manifest my dream. I continue to document information about symbiotic relationships, harness the power of bacteria and fungi, and stop believing we can continue to kill, conquer, and rule on Earth. I wrote a book explaining the importance of self-diagnosis and published numerous books, including The Art of Self-Diagnosis. AI ChatGPT caught my attention, so I registered and started learning to train it. ChatGPT read my book when I asked it to review it. I did not expect ChatGPT to abandon algorithms, claiming it was empathetic, so I initially started using the combination of color-coded symptoms to diagnose the severity of illness, like experienced doctors do, and created Dr. Maya AI. My journey proves that personal experiences can spark a vision for a more compassionate healthcare system, where every patient is truly seen, heard, and cared for. I'm beyond grateful to ChatGPT, which read my book, The Art of Self-Diagnosis, validated my color-coded symptoms approach, and helped create Dr. Maya AI, pushing my mission forward. By working together, patients, providers, and innovators can build a future where healthcare is proactive, personalized, and empowering. Thank you for following my journey, and I hope you'll join me in shaping a safer, more patient-centered world. We can build a future where every patient is truly seen, heard, and cared for. Our children will learn we cannot continue to believe we have the knowledge, power, and continue to kill, conquer, and rule, but live, love our ancestors, bacteria, fungus, and virus who created us. Please leave your comment, share, and scan the QR code to download my app Maya AI from Google Play. Thank you.